I'll stop sharing.
It's all right. I think I can replace it. All right. Good afternoon, everyone. Welcome to tonight's webinar. Thank you for those who tuned in last night and any new people here. So this is going to be part two. So I'll just do a brief recap of our program again. So Stock Sense is a project run by the Victorian Farmers Federation. We are funded by the Cattle Compensation Fund and the Sheep and Goat Compensation Fund, and proudly delivered by the VFF Livestock Group. StockSense was established to help Victorian livestock producers maintain and improve animal health and welfare, as well as Victoria's overall biosecurity status. So we do this through numerous ways. We run educational workshops, webinars like this one tonight, and we develop fact sheets and we publish them online. So just go to our website if you want to check out some free handy resources. We also distribution of related industry material through social media and e-newsletters. So you can subscribe to our newsletter, which is once a month. So we actually got a few upcoming workshops. We have one tomorrow in Bendigo. So any last minute sign-ups is at the Livestock Exchange. We've got a few spots there. So you're welcome to sign up for that. Then we have one next week on Friday at Kyabram, and then some carving webinars on the 10th and 11th of June. So tonight we want to once again have Dr. Conor McConnell, sorry. This will run through some mineral issues during lambing, hypocalcemia, treatment and prevention options, prolapses and how to treat them, and general ailments commonly seen and used during lambing. And we'll once again have a Q&A. This one might be a bit shorter than last night. So feel free to type the questions as we go along. They're anonymous and I'll read them out at the end. So if you think of them, just type them in and then I can get to them when we have the Q&A part. So yeah, Q&A at the end. It will go for an hour with half an hour questions. And then I'll send out these slides along with a link to the recording. So yeah, well, you'll have all that resource at the end if you want to watch back. Yeah, I'll also send out a survey. So if you could fill that in, it really helps us. Yeah, any feedback's good feedback. It helps us keep putting these webinars on. So, and yeah, subscribe to our YouTube channel. So I'll stop sharing my screen and yeah, we can get started.
Cool. Thanks for that, Jack.
It's great.
Um, yeah, me again. If anyone's here from last night, thanks for coming back. And for anybody that yeah is new tonight, hasn't been listening last night. My name's Connor. I'm a vet in Croydon in Southwest Victoria. I do, I guess, 50-50 cattle and sheep, and I'm really trying to grow the sheep side of the veterinary business. Um, some of my interests, other than being a vet, is I've got a Southdown and Charolais sheep stud. Sell some rams and breed and do some sheep AI with them, and um, just something I'm sort of growing in the business is doing the sheep AI. Started it last season, and hope to do a lot more of it, yeah, in the future. And a hobby of mine is I do sheepdog trialing. Um, yeah, it's paddock trialing with dog and three sheep in a bigger area. So that's yeah, a little bit about me. So tonight, um, we talk about more about the yeah metabolic issues during lambing and the different ailments, I guess, that can happen. But I just wanted to do a quick recap again, just one or two slides on um body condition score and use. And I guess the reason why I want to do it again is I think this is the easiest and yeah most efficient way, bang for buck, to get as many lambs as possible. It's probably more important to do this than do lots of intervention at lambing. But by getting your feed right and your body to score right throughout gestation, and towards lambing is probably more beneficial. You'll you'll gain more by doing that than actually doing lots of work during lambing. So you can actually score at lambing time at lambing and lamb birth weight has a strong link. So high condition score U equals a high birth weight lamb. And it's proven a lot of data on this now that there's a strong relationship between the birth weight of a lamb and its survival rate. So ideally, we want to be landing in the live weight lamb when it's born between 4.5 kg and 5.5 kg. Anything under that is pretty light and it's just has higher risk to perish under bad conditions. Also, any lamb that's over 5.5 kg has a higher risk of dystocia. So you really want to be aiming for landing in that 4.5 to 5.5 kg lamb for good survival. Talked about last night. I'm just going to touch it again. Scanning, great tool. If you're a client, if I'm going to be on your farm, I'd be pushing always to make sure you scan your ewes so you can preferentially treat and feed ewes with twins and triplets. So a ewe of twins and a ewe of triplets is a totally different energy requirements than a ewe with a single lamb. And I think doing the body condition score several times during the gestation helps um, helps maintain gives you data so that you can take out the ewes that are thinner, that have less body condition score, and treat them and feed them more. And so that's the most probably economical way to feed. There's no point feeding lots of grain to a ewe that's already 3.5 kg, and there's ewes at 3.5 body condition score, and if ewes at 2.5 body condition score, the same feed. You don't have to feed the heavier ewes as much, while you can give more feed to the ewes, smaller number of ewes that are underweight. Yeah. So on. Just go through the slide again, taken from the lifetime ewe. Just a way to measure the body condition score of you. You do it on the short ribs. It's basically how much fat, how much flesh is in between your hand and the short ribs on both sides. So again, number 3 here. This is ideally where you want to be you lambing at, or in all our gestation is body condition score 3. Yeah, and there's lots of other webinars and stuff online on YouTube on how to measure that. Again, body condition score, key marker for lamb survival. Lamb live weight at birth will have a huge factor like on its survivability. You want to use between 2.7 or 2.5 even to 3.5. Use your scanning as a tool for feeding. Single is more likely to be okay if they lose a body condition score. Generally, a ewe that's got a single lamb will be slightly heavier enemy. If she loses body condition score, is not as crucial. Twins and triplets should maintain body condition score or even add condition during last trimester. This proven MLA done recent studies again. Ewes that put on a condition score during lambing or towards the end have much better lamb survival. And I'll just suggest ask your local vet to give you like guidance on how much feed you need. There's just isn't enough time for me tonight to go over how much hay, how much silage, how much grain you need, depending on body condition score. But there's lots of tools out there, so I'll go and seek help for that if you're struggling. And I would say people generally overestimate the value of hay. I think that was one big learning we had last year in the drought. A lot of clients of mine just fed hay and come up to lambing, then realized that the ewes had lost a lot of condition and then struggled to get that back on. Yeah, it's just something to bear in mind. There was a few questions last night about containment feeding and how much to feed and how you should lamb in containment. So I added the slide today at lunchtime to just help with that. The AWI it's all actually on YouTube. These are 3 links to pretty good webinars. Uh, um, yeah, Deb Scammell has two, and Colin Grove in SA is a vet in SA has the first one, containment feeding. Pretty good webinars, only an hour each, and basically lines out how you should feed and yeah set up containment feeding. And I think it's a pretty good tool for yeah creating a feed wage for use at lambing. So let's put this table in. It's a pre-lambing lamb survival tasks. It's basically husbandry tasks from all to do with repro and getting as many lambs as possible. There are other tasks in the calendar, but I'm just highlighting what you maybe should do to maximize lamb survival. So before joining, especially your ewe lambs, um, should be vaccinating for Campylobacter. So the vaccine is called Campyvax. This is um, abortion causes abortion. It's probably only represents 4% of the lamb loss in the flocks in Victoria, but well worth doing in my experience. Usually, if you do get it, there's it's a lot of it's a big impact on production. It's only certain I guess yeah mobs only percentage of mobs get it each year, but the ones that do get it, it has yeah they lose a lot of lambs, so it's definitely something you should be considering and looking into. So post joining, I'll probably start the first button to the score, just post joining. There's no point leaving it until the ewes are heavy and lamb to do body to scores. It's sort of the horse is bolted at that stage. You want to be doing it in increments before before they start lambing. And I would do a worm egg count then just to see where you're at. Maybe you don't need a drench or you do. So mid gestation, the 65 to 90 days post rams come out, you do a scanning, then you separate your ewes, multiples and twins. You do your body score again. If there are any ewes that are underweight, draft them off to the side, put them into a paddock on their own and feed them accordingly. You call your empties. And at this stage, I recommend that you introduce calcium in some form. Um, I guess a lot of vets and consultants say introduce calcium at the last 4 to 5 weeks, but the way calcium works is it's stored in the bones, and then you when demand increases, you draw it up. The U draws it out from the bones. So I think it's better off to start early and build up the calcium reserves and not let it be depleted. Um, Definitely won't do any harm. Um, yeah, and will only do good adding calcium to pregnant ewes. And then pre-lambing, I guess I go 6 weeks before lambing, only because, and some people say 4 weeks, but I think 4 weeks is really if you have a lot of twins and you're in a drought, 4 weeks before lambing can be quite stressful on ewes that are in poor condition. So I just I had a few bad experiences bringing in ewes 4 to 3 weeks before lambing. They were under condition, but I think doing your pre-lambing drench and worm egg count, um, yeah, is probably a good time to do it. So I'd use a long acting, injectable dewormer and vaccination. So do your 5-in-1 or there's various brands. So we just yeah, we're back 5-in-1 vaccines. And the purpose of doing it pre-lambing is that those antibodies will be in the milk colostrum when the lamb is born. So that's you're giving your booster, annual booster, but you're also getting the benefit that when the lamb drinks the colostrum, the antibodies from the vaccine will be in the colostrum, and they get that 5 to 6 weeks coverage before they get marked. So I just want to talk just a couple of things, the main problems um regarding lamb loss. So Campylobacter, especially in abortion and sheep, um, it's Campylobacter fetus is the bacteria main cause of infectious abortion, stillborns, birth. Well, that I see in Southwest Victoria, anyway. Usually, um, high stocking rates and stressful events really increase the risk of it. So what happens, especially in the ingest the bacteria, usually happens from contaminated feed or water. In my experience, usually happens when the ground is dirty. There's a lot of feces, a lot of sheep manure on the ground in containment or in sacrifice paddocks, and it's usually higher risk. So the signs of Campylobacter is abortion in the last 6 weeks preterm or stillbirths. If abortion starts 2 to 3 weeks after the first abortion, and retained fetal membranes. Generally, ewes don't have RFMs. Like the placenta usually comes out relatively quickly, not like cattle. In my experience, generally when I see several retained fetal membranes, that's a sign of Campylobacter. Treatment, you isolate the defected ewes and reduce the stocking rate. It's quite contagious. Clean up the aborted materials, and you can use antibiotics, so alleamycin. Generally, treat all the ewes with antibiotics when you do diagnose it. And probably you should ask your local vet to advice on that. So prevention is a vaccine, Campyvax, and especially generally if people have had it before, clients have had it before, the ewes have been exposed already, so sort of acts like a vaccine, but it's very I always recommend doing your ewe lambs with it. They're probably at most risk. And one more, just the main with so much containment feeding now, and I guess everyone is supplementary feeding more than used to be. I guess 10 years ago, there's more information on it, so I think everyone's doing it. And pulpy kidney or enterobacteriosis is more common now because we are changing sheep's feed sources, like going to containment or going containment out to grass or vice versa. So it's basically pulpy kidney. Probably all heard of it. It's one of the 5-in-1 um ailments. So causes sudden change in diet is one of the main causes, or fasting. So you introduce hungry stock to grain. So the toxin is from the bacteria called the Clostridial pharynges. The signs of it is that they're standing alone, like with a painful stance. They stand there with their head down, really painful. And generally you don't see them because they die quite rapidly. The sudden death with like a blood-stained froth at the nostril, and they have bloat and rapid decomposition following death. So usually they're blown up, and if you go into try and do a postmortem on them, everything just sort of explodes on you, comes out once you make the incision. Basically, the froth is coming from blood vessels, like hemorrhaging blood vessels from the respiratory tract. This because the bacteria, it's an overload, and there's so much gas released, and there's too much pressure on the lungs. It's blowing up. There's actually no treatment. Generally, if you do notice them, it's too late, and it's very lethal problem. Prevention: you vaccinate 5-in-1. Do it at pre-lambing. Then also the lambs get some coverage um, from the vaccine. Yeah. So just moving on now to, I guess, downer ewes and problems that happen around lambing time, or pre-lambing and post-lambing. So downer ewes are just basically ewes that are laying down that can't get up, or struggle to get up. So those found lying down and unable to rise. So pre-lambing downer ewes, these are the main reasons that you might have a downer ewe. They could be cast, which is just usually a ewe that's heavy and lamb, really big. Then it goes on her side and is scratching her back, or just rolls over because she's so heavily and pregnant, and the landscape prevents her from getting up and rolling back over again. As the longer she lays there, she fills up with gas. It's actually harder to correct that position. So that's what a cast ewe is. Hypocalcemia, breg tox, and acidosis. I'm going to talk about in the next few slides. So emaciation is just a ewe that's underweight, has lost a lot of weight. It's just too weak. It could be part of preg tox as well. They could have a foot abscess or foot rot on their legs. So you should just check that. And also they could have dead lambs. They could be trying to lamb, had the stroke yet, couldn't lamb, and now the lambs are rotting inside her, and she just really crooked from that. So post-lambing downer ewes, what you look out for? If you use lambed and she's down, it could be lambing paralysis. Like this ewe here in the picture had lambing paralysis. This was a big single lamb that was stuck, and it was a very tight pull, and she got lambing paralysis afterwards. Basically, what happens is as the lamb is being pulled through, there's bruising and swelling in around the pelvis, and the nerves are, I guess, pinched with the trauma and the bruising of the lamb passing through the pelvis, and it causes hind limb paralysis. So the ewe can't use the back legs. Back legs, they'll try and stand up, and the back legs will knuckle underneath her. Generally come good with time and anti-inflammatories. Another reason they might be down post lambing is mastitis, and could be before lambing as well. Generally ewes got like a big swollen udder. It could be one side, one udder, or both. It'll be hard or inflamed and maybe discolored blue, and she'll be quite sore and sick. She could be down because she's lame. Could just be a foot abscess or foot rot, or it could be hypocalcemia post lambing. But just to give you a guide, I guess, to try to differentiate between which ailment it is if you use down during lambing or before or after lambing. So first thing you might do is check the eyes, check for a menace reflex. This is just you go to the eyeball and just tap the eye, and if she doesn't blink, or she's sunken, if she doesn't blink, it could be preg tox. So the ewes that have pregnancy toxemia are often can't see. If her eyes are sunken or she's really dehydrated, that could indicate that she's got acidosis. Feeling the mouth, checking the mouth, see if there's anything in there. Check her teeth, examine the insides of her teeth for wear or loss. That could be the reason. If she's got no teeth, maybe she can't eat the feed that's available, and she's emaciated. Put your nose down near her mouth, and smell her breath. It could be acetone, which is like a sweet, acidic smell, like nail polish that comes out of a ewe when she's got preg toxemia. Check her front feet, look for swelling or smell indicating foot rot or abscesses. Check the body condition score. Maybe she's just emaciated or she's over fat. And check the wool. If you grab a lump of wool and pull it and it breaks off really easily, that's a sign of pregnancy toxemia. Often happens when a ewe's got preg tox. The wool just pulls out very easily. So just moving down then to the abdomen. If you use down and you're not sure if she's lambed or not, you can sort of push on the right hand side of the abdomen, and something you can feel a hard suspended body in there, which is the lamb. So you assess if you're still pregnant or not. Check the udder for mastitis. It could be swelling or discolored heat or coldness or abdominal milk. You might be able to like milk the ewe just briefly, and if it's real thick or discolored, then yeah, a really good sign that she's got mastitis. Check the hind feet. Look again for signs of foot rot or abscess. check around the back if there's what feces there's there, if anything's coming out. Check if it's diarrhea. It could be that could be that's acidosis. If it's sticky or pasty consistency, it's probably preg tox, or a hard, dry pellets is hypocalcemia. Check the vulva. If you actually open the vulva with your fingers, and if you don't know if she's lambed or not, usually if you use lambed, there's bruising just inside the vulva. A clear mucus is normal. It's red or smelly or dark or black. Usually means he's got either rotten lamb inside, it's dead lambs, or she's lambed and she's just got a uterine infection. So it might be worth just doing a further examination on that. Um, Calcium response. If you use down, always just give her calcium. It could be just hypocalcemia. So inject 1.5 ml per kg. Subcutaneous calcium gluconate, or yeah, a strong response within 10 to 15 minutes sort of suggests that it was hypocalcemia. Pregtoxemia. So pregtox is basically the ewe is starving basically. She's lost a lot of condition. And generally this happens with you that have two to three lambs, two to three fetuses inside. So it's a metabolic disease. Of course, when you use nutrition is inadequate for the last month of pregnancy. Other factors could be interrupted feed intake for 12 to 24 hours. Like say if you take them in to shear them or drench them or whatever during late pregnancy, that can really yeah, put them into ketosis. So what pregtoxemia is basically the fact that they're in ketosis, yeah, is creates a toxic event in the ewe. Basically, she's running off the fat of her back, and when that runs out, she gets pregnancy toxemia. So there's greater demand from two fetuses. A ewe body composition score of 2 or less has a greater risk, and lameness can contribute to that factor. So if you've been heavily in lamb and has got foot rot or an abscess, she's not going to be able to get around as much to get as much feed as she needs. So she's not meeting the requirements. So she's higher risk of getting preg tox. So overconditioned fat ewe pregtoxemia, not as common. Never generally, it's always the opposite way, opposite the too late. Usually appears as a continuing outbreak, like over 2 to 3 weeks. Separate separate from the mob, hold their head they hold their head low and act very depressed. Generally don't get up when you walk up to them and they're just dull and really depressed and not even sometimes don't even look at you. They don't graze and they're very easily approached, so they're just like they're a bit like dummies. They have an absent menace reflex, so that's just putting your finger on the eyeball and they don't blink. They're just They have an acetone breath, which is like a sweet sort of nail polish smell on their breath, because that's from the ketones they're releasing. There's a wool break. If you reach for a little bit of wool and just pull it, it'll just come off very easily. They have scant, dry, sticky yellow feces. So what treatment is ceton, which is dextrose, 50 ml orally via catheter tip syringe, like it's demonstrating here in the photograph. Ceton is propylene glycol solution, so it just gives you an energy boost. So administer it slowly into the cheek pouch. Keep the ewe's chin slightly elevated to encourage swallowing. Do not drench directly down their throat. You can't. It's not like drenching them with a oral drench for a dewormer. They have to actually physically swallow it. You just put it on the side of the cheek and raise their head, put it on slowly so they can swallow. If they're unable to stand, euthanasia with captive bolt should be considered. In my experience, if they're in really light condition and you can diagnose preg tox, the outcomes are not great. Yeah, there's a high mortality rate for preg talks there, and they've got and downer ewes, especially with multiple lambs inside, and they're in poor body score. Something to consider. It sounds gruesome, but if you know a ewe is really close to lambing, or she is lambing, she got preg talks, and but she's not quite opened up yet, an emergency cesarean is an option. So if you have a captive bolt and you know how to use it, you've been trained, you could euthanize the ewe and then quickly open open the ewe up with a knife and get the lambs out. It's you've got about 3 minutes to get the lambs out. Like when you euthanize the ewe or with a captive bolt, the heart is still pumping for about 2 to 3 minutes, so that the lambs still have oxygen on board, but you have to act pretty quickly, and you should easily be able to get the lambs out in, yeah, 2 to 3 minutes. But only do it if you know the ewe is at lambing quite is ready to lamb already. Lambing paralysis. This is when the ewe just had a really difficult lambing. The lamb was big. The soft tissue in the pelvic canal has been bruised or pinched against the pelvis, and that damages the nerve or has swelling around the nerve temporarily. Yeah, it causes inactive. So it usually how you tell if a ewe's got lambing paralysis, she goes to get up and her back legs sort of knuckle underneath her. That's a key sign. So treatment is meloxicam, 1 ml per 20 kg subcutaneous. So every second day for 11 days until she stands. Also give her, if she's not standing, give her yeah, hay and water or grain. Sometimes I use like a I've got a bulk bag or a wool bag, old wool bag, cut um holes in it for 4 legs, and generally for 2 to 3 days I'll try and stand them up so she can put weight on her back legs. I think it helps if they can put weight on their legs, and it speeds up the recovery. But generally they come good after 1 or 2 days. The longer they're down, yeah, the less chance they have of surviving. So yeah, if you've been doing it for a week or more, yeah, you may consider euthanasia if it's not going to get any better. Hypocalcemia. So the effects of hypocalcemia occurs in the last month of pregnancy. So higher risk when feeding a lot of grain or so grain grain doesn't have any calcium in it. You only get calcium from grain feed. So it's actually only a very small window when you actually get enough calcium is like when they've got good pasture, but it's not, if it's too lush, it goes through them too quickly and they can't absorb it. So it was a very yeah, generally ewes need more calcium. It's always a good idea to provide calcium. So dry, hard pellets of feces in the rectum. That's a few of the signs. Sudden collapse and late pregnancy. Treatment would be Ball, calcium pergluconate, 1.5 ml per kg, and generally at 75 to 100 ml under the skin, administered over the ribs. And I generally, if it's a bad case, I do it twice a day, once in the morning and once in the evening. And you rub it vigorously into so it's disperses evenly, and also give ceton, which is, yeah, dextrose, glucose, 50 ml orally with the catheter syringe. So prevented, I generally advise start from scanning, so between 60 to 90 days of gestation. You can wait until the last 4 to 6 weeks. Generally, people get away with that, but I think it's better off to build up the reserves. Generally, they can't get calcium if it's a drought, they're feeding grain, they're grazing cereal crops, calcium is low. So one method is using stockweight lime, and you try and get the finer powdery stockweight lime. Dolomite, which is actually has some calcium in it as well, and salt. And salt is used, so that's 40-40-20. Dolomite's got calcium and magnesium in it. Um, so that's 40-40-20 ratio. The salt's in there for palatable. It gets them to eat more of it, I guess. It makes it more palatable. I get what I've noticed is initially they eat a lot of it, but I think that's because it's a novelty and they like the salt. But that novelty wears off after a week or so, or 10 days. Then they just gradually eat it. Often I have clients that only do stock grade lime and salt and seem to get away without any magnesium. I think the lime, so the calcium in the lime is the most important thing. Actually, I've looked for evidence that about magnesium recently. I've really wanted a big search, seeing if magnesium is really needed for use. And I haven't found any evidence, peer-reviewed evidence to say that magnesium is vital. It's definitely calcium is the main thing they need. If you're using a loose lick from a yeah from your local supplier, like yeah, your rural supplier, then that's fine. You'll keep, and if you want to keep going with that, and it might have copper and selenium and everything else in it as well. That's great, and keep going if you think if you want to. But the main one for use pregnant use is definitely getting calcium. So I would avoid husbandry tasks if it's not essential and high risk mobs. So twin bearing ewes that may not have had been feeding a lot of grain and mightn't be in good condition. I'd avoid taking them to the yards if you could avoid it. Just anything that's hypocalcemia is so important. Just want to make sure I've done covered that. Yeah, I think using salt and lime will get you 95% of the way with yeah, minerals stuff leading up to lambing. If you are in a known copper deficient area, so some parts of Southwest Victoria are, like I know Woolsthorpe, Hoxdale down here are, and some of those clients I have down here and supplement with copper as well. But in general, calcium is the main thing around lambing time that's it's usually deficient. Acidosis, I'd say that's the acidosis cases last probably 4 or 5 years have increased if you're being a large animal vet, because I guess everyone's feeding more now and feeding and getting into containment and supplementary feeding. So the cause is introduction onto grain too quickly. So less than 2 weeks. So there's a rapid pH drop. So it gets very acidic in the rumen from lactic acid formation. So it kills the gut microbes. So the acidosis, the quick release of starch kills the microbes in the rumen. And when the microbes die, when the bacteria dies, it releases a toxin when they die. So they go into endotoxic shock. The signs of acidosis are a dull and depressed, and they'll have like lameness, like laminitis, like a horse would have. They're recumbent and apneic. They can have sudden death or die within 1 to 3 days. If it's a mild acidosis, generally they come good. Yeah, sometimes I do nothing, don't treat them when they come good, and other times I've just given them Oxytet and yeah, and meloxicam for the laminitis. I know that the textbooks say you give bicarb. Um, I haven't had much success with giving them bicarb, to be honest. Generally, I don't think it tells you to give enough bicarb. I generally give 70, yeah, with 70 grams. says in the textbook, but I think you probably should do more. The best thing for them is actually um, use sheep manure, a healthy sheep manure that hasn't had acidosis, make it into a slurry or a liquid form, and drench the use. You only need 100 ml. That will actually take the raise the acidity in the rumen more than bicarb will. It sounds a bit gross, but that's actually the best way to do it. Grind down, mix up, make a slurry and a liquid out of a ewe dung that hasn't had acidosis, and then drench the ewe with that, or actually remove some rumen content. You can get a vet to do pump some rumen content with a tube out of a healthy ewe, and then put it into the affected acidotic sheep. That works pretty well. Prevention: introduce the grain over 3 weeks. Start with 80% hay, 20% grain, and double the grain every 2 days. So basically, you're just gradually building the grain up. Don't just give them as much grain. Add a lot of grain, obviously, for to begin with, and you just build it up gradually. Prolapses, relatively common around lambing. You can have vaginal prolapse, which this is what you see in the picture, or uterine prolapses. Life-threatening, but can be managed. Contributing factors is containment for the lambs, laying down a lot. Many ewes recover well. Um, actually think there's probably underlying pneumonia happening and a lot of ewes to prolapse, any kind of prolapse. And it's even lambs and feedlots, rectal prolapses, and even ewes as well. Uh, any ewes that have done postmortems on with prolapses, there's always lung damage as well. So I think with coughing, there's a lot of pressure going back towards the rectum, and I think that's what either the vulva or the rectum gives way if there's a lot of coughing going on. Just my 2 cents worth, my opinion, what I've seen in the field. Vaginal prolapse, so increased abdominal pressure from growing lambs can kink the ureter, so it can't urinate. So catch the ewe gently. Try not to let the ewe knock the prolapse around against something, against the rails or anything. So clean with warm water, lubricate, put lube over the prolapse. Use lots of lube, and then you sort of manipulate with your fingers. Use sort of a greater surface area of your hand if you can. You don't want to poke it with your finger because your nails will go through it. So you want to get that in, get it back in. So take time to massage back in correctly. It may take 10 to 30 minutes to get back in and work between contractions. If she's pushing, contracting, don't fight against it. Wait until she's not contracting and then get back in. Just be careful. She may urinate straight after, as the ureter may have been pinched. So position important as it use gravity. Yeah, gravity will help you if you use the technique here in the picture with a 2 meter rope with two loops. Put the two loops above each hock, and then you can elevate the ewe and use gravity to push the prolapse back in again. So a truss. This is a technique basically to prevent them from prolapsing again, and they can also still lamb through this. It's pretty good technique. So it can make homemade truss. It's a 5 meter of 25 millimeter wide strap, a gear strap around the chest first. Then it goes around the chest and down the spine. And then you tie the two together at the top of the hip level, and take each end down each side of the tail. This is where it actually goes over the vulva, cross over below the vulva, and then bring each end forward between the other and the opposite back leg, and bring the ends out in front of the back legs and tie each end to the section of strap running along the back. There's actually pretty good YouTube videos on this if you ever use it, but it is a pretty good technique to keep prolapse back in. I should have sort of got the link and put it here, but if you search for it, I'm sure you'll find it. The truss must be tight and left on for 2 days, then removed. If the prolapse reoccurs, reapply. You need to monitor these used closely. Um, you watch for immediate impending lambing and loosen or remove the truss before lambing begins. I've had used lamb with this. It usually just goes to the side. Permanently identify the U ear tag and cable tie it in the existing ear tag or by EID for culling as vaginal prolapse is likely to recur the next lambing. So you probably want to cull that U again. If you get a vet out to fix it, sometimes they use a Brunner needle, which is basically a big needle that goes down each side of the vulva, and you can stitch the vulva closed temporarily until she lambs. But you definitely would want to be having a epidural before you want to do that. This is a picture, sort of the largest picture I've seen online that yeah, off the same thing, obviously, but it's a more structured trust that you can buy. But that sort of gives you an idea of how it works. Same thing. I'm just doing new. This is this is another device. I'm pretty sure it's called. Correct me if I'm wrong, but I'm pretty sure this is called the Kiwi. Goes this end goes into basically into the vulva and keeps the vagina back in where it's supposed to be. And you tie these onto the wool to keep it back in. Honestly, haven't had much success with these. I always find they come out or the little bits of string come off the wool. I've had more success with the trusses, and yeah, that's just been my experience anyway. Uterine prolapse. A uterine prolapse is recognizable by like lots of little cotyledons. Those 70 to 100 brown button-like structures occurs after lambing when the flaccid uterus follows the lamb out and everts through the vulva. So basically, what you can see in the picture here is the uterus inside out. This would be inside the uterus, and those little nodules you see, maybe not really clear, but yeah, this is what the placenta attaches to. This is the blood supply and the nutrient supply to the lamb. So what happens sometimes at lambing is this, as the lamb comes out, this comes with it. And it's basically sort of like a sleeve formation. So this needs to go back in, and the end that's lower to the ground here needs to be, yeah, probably in the furthest to get back in. Outcomes are usually good, like with prompt care, including them getting back in the lamb and not prolapsing again. So handle with great care. The prolapsed uterus is delicate and may contain intestines. Any rough handling can cause significant damage. Elevate the hind legs, like using the rope that you've seen with the vaginal prolapse. This helps reposition the uterus and reduces pressure. A hind end hoist or slope can assist. Ensure full inversion. This just means it's in the full way. Basically, this needs to go back in, but it needs to be positioned correctly so it goes in, everts fully. Uterus must be completely inverted after replacing it. Insert a gloved lubricant arm up deep into the uterus, usually up to the elbow, and gently unfurl the horns of the uterus with your fingers. If this isn't done, the uterus is likely to prolapse again. It can come back out. Basically, by doing this, you're using gravity to keep it back in again. If it's in its right position, it generally stays in there. No need to stitch in full inverted, if fully inverted. If correctly repositioned, the uterus will stay in place. And with these, I use oxytocin, 1 ml IM. It stimulates uterine contractions, which actually makes the uterus smaller and has a lesser chance of getting out. Gives some calcium, 1 ml for 1.5 kg, subcut, Mindol, supports muscle tone and helps prevent prolapses, and also give antibiotic because even though you'll clean that uterus before you put it back in again. You can never. It's not not a sterile environment. So recommend using oxytetracycline. Generally the trade names around here is Tetramax or Alomycin, 1 ml per 10 kg. Guess that was probably the main lambing stuff. I just wanted to say if in a drought year or depends what part of Victoria you're in, so patchy at the moment where it's dry or where people have feed or people don't have feed. But I guess after lambing, um, I think wetting and drying ewes, seeing if ewes have had a lamb or not, really can take the pressure off feed wise. Getting rid of those cull ewes can take the pressure off. Yeah, with feed, and especially at the moment, the cull ewe price is pretty good. So I think it's well worthwhile going through the ewes. Um, I think I might leave it at that. Were for questions. I was going to talk about early weaning, but I think we've covered a fair bit, and I'll probably do some questions if that's all right.
Beautiful. Yeah, we do have quite a few here. So,
Yeah.
like the last half an hour, everyone will just do questions. So send them through, and we'll get through as many as we can. We also great presentation, Connor. That was awesome. A lot of information there. We have a question here. So, what can be done when reviving a newborn lamb and they have lockjaw?
Lockjaw.
Yeah.
Right.
Is that common in lambs or?
I'm not entirely sure what you mean by lockjaw, but reviving newborn lambs, um, I would do first of all, I would heat them up. For the first thing I would do was make sure the airways are clear. And then I would use something like a pen or a bit of straw or to poke inside their nose to try and make them sneeze. Then I would dry them. Then I would use like a get their back legs and hind legs and uh, using an accordion motion to try and get them to breathe. Heat the lamb up, give it milk the ewe, give it colostrum. Also, you give the interperitoneal icing sugar and water, 50 ml and 12 grams of icing sugar, or do that orally with a stomach tube as well. Yep.
Yeah, beautiful. I've got a question here. So, 4.5 to 5.5 ideal birth weight. Does this vary between breeds, e.g., baby doll breed being a smaller frame? And would the ideal birth weight be different then?
Um, with baby dolls, I wouldn't. I mean, you would try not to go under 4, I guess. They're slightly smaller. Yeah, 3 point. You'd probably go 3.8, I guess. I haven't lambed a lot of baby dolls, to be honest. I don't really know, but I know there are smaller. They are smaller Southdowns than the normal ones. So yeah, I'd be still aiming for it. Yeah, I'd like a bigger lamb than a really small lamb any day. Yeah.
All right, we got a few on the lick block. So, there's one here. So is it negative to have constant supply of calcium lick blocks all year round?
No, definitely not. No, there's probably if there's a benefit in it. You just when you use dry, it's just costly for them to be using the lick block. Like there's no great demand on them. The demand for calcium like doubles or triples when in the last trimester. That's just sort of yeah. Long as I would say from joining onwards or scanning onwards is key to like to getting enough calcium. But there's definitely no harm of doing it all year round. Yeah, and some places, if you're, I guess, yeah, if you're in a cropping area and you're grazing cereal and they're eating grain as well, like you're constantly nearly deprived of calcium, so it probably would be a good idea. Yep, yep.
Another question on the calcium. So, is it better to use liquid, loose leak, or the blocks equally as good?
Um, I think if you can keep the lick blocks up to them, I think it's in my experience. I hope no one owns a hardware store here or something, but like there's molasses generally in the blocks. I reckon often they're just liking that because of the sugar in it. Or I think giving them loose like gives you a more I think it ends up cheaper and gives you a more true indicator of the needs of the minerals. Or I think sometimes they're having licking the lick blocks because if you look at the ingredients, a large percentage of it is molasses generally.
Perfect. Well, speaking of molasses, we've got a question here, a bit of a true or false one. So many suggestions to feed molasses to use for the last trimester or to avoid pregnancy toxemia. True or not?
Yeah, I think it's a good help. It's not body condition score is key, but yeah, molasses will just provide more dry matter and energy. Yeah, I think it's a good source of energy. Yep.
Beautiful. Keep sending them in. We've still got like, around half an hour, so any questions that anyone wants answers, now's the time. We have a question here. So, if ewes are round, perhaps overweight when putting a ram in for joining, is it unhealthy to fall pregnant if they're too heavy, or like how do you kind of judge that?
Nah, in my opinion, like I think ewes get a overweight ewes. Um, if they hadn't had lamb the previous year, they get really obese because they haven't had a lamb and they weren't cold the next year. And then they're not in lamb this year again. So often they say, "Oh, that she didn't go in lamb because she was too fat." But I think often it was just that she wasn't in lamb the year before either, and that she just gained weight over the 2 years. But I, yeah, I never see. I know there's a lot of talk about overweight ewes and fertility and not lambing well, but it's not my experience. It's often more that they're underweight. But yeah, if they're just under between 3 and 4, then you'll be fine. Yeah,
Beautiful. We've got a few questions on prolapses here. So,
yeah.
will a vaginal prolapse fix itself without human involvement?
Generally not.
All right, short and sweet, beautiful. And so if a ewe does have a prolapse, is it definitely worth culling the animal, or like what's the percentage of if you can get them in lamb the next joining?
If it's a vaginal prolapse, I generally call them because I think it's I think studies have shown that it reoccurs again quite frequently. Yeah.
Ah, beautiful. Um, they have a question. So can you get lime, dolomite, and salt from Bunnings, or should you go to an ag store like Nutrien? Do you know that at all?
No, the lime and stuff that you get in Bunnings is in stock grade. Yeah, go to just shop around and ask your local like nutrient or your ag stores, Acme or your CRTs, and they should be able to point you in the right direction. Yeah.
Beautiful. So if you're talking about injections, e.g., 1 mil of IM, does that mean into the muscle, or subcutaneous under the skin, not into the muscle?
So meloxicam is that? Sorry, which injection you thought? Did they say
I
which one?
think they didn't actually specify that one,
Yeah,
so
I am means
IM, yep.
intramuscular, and
Yep.
SC means subcutaneous. Yeah, so meloxicam is sub under the skin, subcut,
Yeah, yep.
and like the oxytetracycline will be IM, which is into the muscle.
Yeah, beautiful. So yeah, that was another question actually. So you mentioned Melexicam for landmarking, which is more effective and easier to administer by IM or buccal. Do we need to add immediate um analgesia as well?
Analgesia.
Analgesia.
No, I reckon just given your meloxicam subcut under the skin, like it'll generally be half a mil or a mil, depending on the size of the lamb, is pretty good. That's the best pain relief you can get. Yeah, yeah. So
Yeah, this
so with that, I say if you're mulesing, that's a different story. But with putting a ring on the testes or a ring on the tail, it's actually the next day where it's the most painful. Um, so that's when the meloxicam kicks in. It takes like 4 hours for it to work, but that's when it actually needs it. And then it lasts for 36 hours. But yeah, the difference, you can see the difference later on in the paddock, the ones that have got meloxicam and the ones that hadn't. Yeah, yep.
So when you're treating hypocalcemia, can you use Cosmag powder form instead of Dolomite?
Not for hypocalcemia because there's no calcium in Cosmag. You need calcium. That's magnesium. So yeah, you need either. There's different like under the skin products can be like Minball 4-in-1 or can yeah, there's double cal it's called, so it needs to be actually calcium. There are I haven't used it, but I know I've heard of oral solutions like oral calcium solutions that you can probably get online. But I've got I actually give it IV or under the skin, but as a vet. But yeah, that's what my only experience with it is. Yeah, using the calcium subcut.
Alright. So is vaginal prolapses hereditary?
Um, but I don't know to be honest. I suspect that it is. Yeah, and I reckon there's a pneumonia, yeah, underlying pneumonia, yeah, relationship there as well. Often I've
Mhm.
heard other vets say as well that yeah, that generally any kind of prolapse there generally is an underlying coughing event as well. Yeah.
Nice. All right, we've got a good biosecurity question here. So someone said they have a small flock, not exposed to any other stock. Is a full vaccination schedule still required?
Um, yeah, because like most of the 5-in-1 is it's mainly all stuff coming from the environment. It's not nothing to do with actual stock. So like your pulpy kidney, um, black leg, black disease, malignant edema, all comes from the environment. So it's not really anything to do with also Campylobacter, nothing to do with other stock. It all comes from the environment, yeah, and bacteria. So I'd say yes. Yep, yep.
Yeah,
Yes.
beautiful.
Yep.
There's a question here about that YouTube video for prolapses. I think Connor might send that to me, and I can send out the video link in the slides for this one. And also, there's a question here about the recording. So yes, these will be uploaded to our YouTube channel, and I'll send the slides out for it as well. So yep, that should be good. We got a question here. So someone's saying that Ram jumped the fence and got in with some 10-month-old Hampshire ewe lambs. Should they be concerned?
It will depend on what month it was and what size your ewes were. The Hampshire Down ewes, yeah. Yep.
Yeah, well, they're 10-month old, the ewes.
Yeah, it wouldn't if they're 10 months and it's like March, April, May,
Yeah.
then you would be concerned, definitely. Yeah, if they're over 45 kg and it's within and they're 10 months old and it's March, April, May, then yeah. You can you can give them PG, prostaglandin, to cause an abortion if like yeah, but you need to talk to your vet about that, your local vet. Yeah.
Oh, beautiful. Keep sending in those questions, guys. Like we only got about three or four more, so keep sending them in if you want it to keep going. Got a question here. So is Minble something that you can get from the rural store, or is it something that a vet has to supply?
No, you can get that from yeah, nearly anywhere now, everywhere, rural stores, like yeah, wherever, yeah, yep, they're generally supplied everywhere. Yep.
Oh, beautiful. Can Ceton be given more than once, and if so, how often? So
Yeah.
CETON.
Yeah. You could probably
That
give it
right?
3 times, probably give it 3 times a day. It's basically just sugar, energy. It's just like drinking a real fizzy drink, but you're just providing energy to the ewe that's got in ketosis. You're just providing energy. So yeah, you can give like every probably 3 or 4 hours, you can give it another 50 mil. Won't do any harm. Yeah.
With acidosis, do you know is certain grains used more susceptible to?
Yeah. So whole grain. So what happens with acidosis is like it's the sudden release of starch, like really concentrated sugar causes acidosis. So pellets, pellets like dissolve really quickly and like become into mush, and the sugar's released really quickly. And that there's a lot more acidosis in pellets than whole grain. So whole grain's got a husk around it, and it takes longer for the acid to break down the husk, so it's slower release. So there's less risk with whole grain than pellets. Yeah, whole grain, not crushed grain, is a lot safer with acidosis. Yeah.
We got a question. So, would you campy vax all ewes or just maidens?
It will depend if you've had exposure already. Um, I think if you got high value, if you're stud sheep, I would be doing camping on everything. If you're used, you've had exposure before, and you've left the affected ewes in the mob, then yes, I would possibly not vaccinate them. But your ewe lambs that weren't around when that abortion episode was happening may not have exposure already. So like I would vaccinate them. They're at the highest risk because they haven't got the antibodies yet. For the ewes that have been around from the previous year, when all their mates, sisters had were having Campylobacter, they've basically been vaccinated with the exposure of the true Campylobacter that ewe lambs won't have. Yeah, that's how. But I think it's probably good practice if you haven't had it. You can check your antibodies for it, or use antibodies levels, and decide whether you want to do it or not. Yeah.
Got a question here. So, Glanvac with vitamins such as B12, are they worth the extra cost?
Hmm. Is anyone from Zoetis listening? Um, yes, yes, it is. I think if you're having trouble with cheesy gland and arthritis, then yes, it is. You should do it. If you're not, and it depends if you're selling your lambs to the abattoir or selling them in the sale yard. Because if you do have problems, it'll get picked up at the abattoir. Yeah, and you'll get some meat condemned. But if you're selling them at the sale yard, then yeah, that problem goes to someone else. Yeah.
We've got a question here. Where on the lamb do you administer Melexicam S/C when landmarking?
You can do it. I generally do it in the neck. Just not right under the ear, just down maybe 10 centimeters down in the neck there. Or you can also do it in the ribs, just under the yeah front leg, just in there. But generally I do it in the neck. If you're doing multiple things in the neck, I would do it yeah under the skin and the ribs instead. Yep.
I feel like this question here, this person is talking from experience. So, do you have any tips for how to get a head snare on an unborn lamb when they are slippery and you can't see?
Yeah. I actually use a head snare. Sometimes if it's really hard, I have a head snare that's like actually it's actually like a similar it's basically like a phone charger lead because it's got like a little bit of turgidity on it. Oh, it's actually um it's a little bit stronger. So sometimes with a rope, it's just you can't push it over. It's too flimsy. Sometimes if you've got some a little bit of strength to it, you can get it over the head, behind the ears, easier. Yeah. Um, if sometimes when it's hard, you just do put it the whole way over the head. Like don't even try and get behind the ears. Just like put it around the neck and then change the stance of it. Then put it into the mouth. If you're trying to do it like too fancy behind the ears and into the mouth straight away, it's harder. Just worry about getting it over the head first. Put the whole loop right over the lamb's head, and then worry about putting it into the mouth after that. As long as you get it over behind the ears first and around the whole head. And if you really do that and give it just a light pull towards you when it's around the neck and head, then it's should be fine. And then change it. Don't do your main pull with it around the neck. Just pull it towards you slightly. That makes
Beautiful. We
sense.
have a bit of a technical question here. So, what is the minimum level of calcium in the blood for older use scan with multiples, and how quickly can a low level be improved?
What was the last part of that question?
How quickly can a low calcium level be improved?
Ah, um, the first answer, the first part of the questions, I actually don't know the millimoles per liter. I can't remember. I didn't do it at uni, but you can look that up like
Yeah.
relatively easily. But I guess if they're consuming like a lot of calcium, you can actually get away with having them having been depleted earlier. If you can just happen to keep them eating it, I can nearly just tick them over during the pregnancy, but it's risky. Yeah. I don't know if that answers the question, but yeah, you can do blood and like blood tests and liver biopsies if you really want to check. Yeah, beforehand. Yeah, sorry, I have to look that up for you. The millimoles per liter of calcium. I'm just not quite sure. Can't remember. Yeah.
That's all right. Yeah, a few more questions. There's not many questions left, so keep sending them through and we can keep going. But we've got a question here. So I occasionally use Minball 4 and 1 for hyperglycemia, sorry, treatment on use. It comes in a 500 ml pack, but usually only need 100 to 150 mils per dose. Um, Packet instructions say to discard the portion after 24 hours. If stored correctly, will it still keep once opened?
No, I think no. I use I use mine's. Yeah, if you open it and use it on you, I'll use it the rest of it a week later. Yeah, and I find it still works fine. What I do is just after I've taken it out of the U, I just like dispose of a little bit, like a couple of drops or 5 ml of it, so it cleans out the end of the thing, and then I've got like a little I kink the tube, and I put it's like a clamp on the line so it doesn't leak, and I just put it in a dark area in a cupboard. So yeah, I've used it. Um, yeah, use that. Yeah, yeah.
Is a vitamin A, D, E injection useful in the lead up to lambing?
Is what was the things again? Was the
Vitamin A, D, E.
Yeah, yeah, it is. I've only recently learned about it and I've known people that use it, and it seems to be have some benefit. But by far, calcium is generally the main cause of problems. Yeah.
We got a question here about colostrum. So how long can you keep frozen colostrum? Is it okay to use after a year?
Yeah. Yep. I don't know how many years it can be frozen, but yeah, at least 2 years. Anyway, I'd say. Yep. Yep.
Beautiful. So can you give a full 5-in-1 vaccination now and a booster 6 weeks prior to birthing in October?
Uh, how many months is that? You probably shouldn't go. You probably want to. I would wait until closer, maybe like July. July. Yeah. If you go on the Zoetis website and tell it gives you really good instructions on 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 how to when the timing to vaccinate. But in recollection, you shouldn't go probably over 3 months between the first vaccine and then the second one. For the first time you do a vaccine, it should be done within a certain amount of weeks. Not yeah. But just clarify that with Zoetis on the website. Yeah. And there's really good pictures and videos on the Zoetis website on how to, yeah, the position of where to vaccinate and give meloxicam as well. There's good diagrams. Yeah.
Beautiful. We only have a couple questions left, so keep sending them in. So there's one here. Being a large scale farm, would you recommend joining or culling the older ewes white and orange tags? So maybe just talk about the
Yeah.
conception rate for the
I
older
would,
ewes.
what I would base it on body condition score. If they've got good body condition score and you've went through their udders and taken out anything that's got mastitis or problems, then, and if you're willing to feed them if need be, then yeah, I would join them. Yeah. Especially now with numbers of sheep so low. And hopefully I reckon the lamb price is going to be pretty good. So yeah, I would all depends on their body condition score. Yeah, really. Yeah. And what you're
Beautiful.
willing if things get tougher, are you willing to like feed them grain? And how much feed have you got available? Yeah, yeah,
All right. Well, I think that's about all the questions we have. So we might need to wrap that up. I'll just share my screen. So we got our survey here. So this is some ways you can stay in touch with us as well. So we got yeah, some sources there. And this is a QR code. So could you if you give that a scan, it just helps us to be able to keep running these in the future and how to improve them. So I'd like to thank Connor. That was some great information. I hope everyone took something out of it. I definitely did. And yeah, thank you for both parts, Connor. And we'll send the slides out to everyone along
yeah.
with the recording to these webinars. So yeah, thanks, Connor. Really appreciate it.
No worries. Anyone wants any sheep advice or yeah, give us a email or give me a ring. Keen to do some more sheep vet stuff. Yeah, that'd be great. Thanks for
Awesome.
having me.
No worries. All right. Thanks everyone for tuning in. And yeah, we've got some events coming up in the future. So just check out our website for any of that. And yeah, thanks for attending. All right. See ya.
No worries. Thank you.